Good day. We are Group 3 and we will be discussing a medical device which is inhaler. What is inhaler? An inhaler is a portable medical device which is usually delivered in a form of mist, aerosol, or powder that most commonly used by people with asthma and chronic obstructive lung disorder through inhaling. Today, we will introduce two main types of inhaler which are metered dose inhaler or MDI and dry powder inhaler or DPI. Under DPI, we will be discussing discus and rotahaler inhaler which are shown in this slide. Let's differentiate first MDI to DPI. Both of them are portable, compact, and has a short treatment of time. The difference are that MDI are in aerosol form with propellant and spacer needed. It also requires hand-breath coordination. It is time-consuming to teach, cheaper, and requires deep and slow breathing. While DPI are in powder form, no propellant and no spacer needed. Also, no hand-breath coordination needed, that's why it is easy to teach, but more expensive and requires high inspiratory flow. First is metered dose inhaler or MDI. It is an inhaling respiratory medicated device with mouthpiece where it excretes a measured amount of medication to the lungs. MDI has 6 illustrative parts, which are number 1, canister that is made up of stainless steel or aluminum where the medicine resides. Number 2, actuator made with plastic. It has different color represent the other kinds of drug that it delivers. Number 3, metering bulb is present within the actuator which delivers the measured quantity of drugs through aerosol deep into the patient lungs. Number 4, mouthpiece is where the patient places their mouth. Number 5, dust cup. It is always included to prevent the inhaler's contamination whenever the patient does not use it. And lastly, actuator nozzle is the one who gives an increasing concentration due to the collision between the particles. MDI are commonly used to treat different respiratory disorders and difficulties such as infectious pulmonary diseases, cystic fibrosis, pulmonary arterial hypertension, COPD, asthma, and infectious pulmonary disorder which have an overlapping symptoms and signs that affects the lungs and breathing. The first example of MDI is Ventolin, with the generic name of salbutamol that is used to provide a relief in asthma and COPD symptoms. Another is Foster, with the generic name of beclomethasone, and formoterol is a combination drug that is included in the long-acting bronchodilator and corticosteroid inhalers. For the proper usage of MDI with the bulb holding chamber, that is a type of spacer that includes a one-way bulb at the mouthpiece, the steps are the following. First is to wash your hands properly. Then remove the cap of the MDI and hold it upright, then shake it vigorously. Second is to put the MDI in the chamber's open end opposite of the mouthpiece. Next is to exhale completely. Then place the chamber's mouthpiece between the teeth and firmly seal your lips around it. Press the canister one time, inhale gently through your mouth, and if you hear a horn-like sound, you are breathing too fast and need to slow down. Number 4 is to hold breathing for 10 seconds to allow the drug to reach the lungs airways. Lastly, breathe slow out. Repeat the steps above for each puff your doctor has authorized, and take note that you need to wait a minute before each puffs. When you are done, place the cap of your MDI. The next proper usage is for MDI without a bulb holding chamber. First is to remove the MDI's cap, then hold it upright. Second, shake vigorously, and then third, exhale completely. Fourth, place the inhaler's mouthpiece in between your teeth, then firmly close your lips around it. Press down on the canister once as you begin to breathe in slowly, and continue to breathe in slowly and deeply as you can. It should take you around 5 seconds to fully breathe in. Lastly is to hold breathing for 10 seconds to allow the drug to reach the lungs airways. Repeat the steps above for each puff your doctor has authorized. Wait roughly a minute between your puffs. When you are done, replace the cap on your MDI. Counseling is important in taking medicines, specifically using inhaler. First, it's maintenance. Taking note the amount of medication remaining in your inhaler and the amount of puff is important. Even if your inhaler continues to spray after consuming all the puff, it must be discarded. Marking calendar is helpful to count how many days until your medication runs out. Choose 2 days prior to this date to have your prescription refilled so you don't run out. Also, it should be stored at room temperature in an upright position. The common side effects of using MDI inhaler are fast or irregular heart rate, chest pain, shakiness, nervousness, and other that are written to the output. It also has serious side effects such as tightening and swelling of the muscle around your airways with the symptoms of trouble breathing and wheezing. Disposing it properly is a must. The best way to dispose it is by giving it to the local pharmacy since it is considered a hazardous waste.
My name is Bian Alexei Galming, and for today's presentation, I am going to discuss or present to you 2 examples of DPIs or dry powder inhalers, which are the discus inhaler and the Rotahaler inhaler. So for the discus inhaler, it is a meter device, as you can see here in this slide, the picture of the discus inhaler. So it is a meter device dry powder inhaler consisting of a plastic device which contains the powdered medication. It is a device that is activated when breathed and inhaled that will release the medication automatically. So the discus inhaler has a greater chance to enter the small airways in the lungs of the patient when it is inhaled correctly. So in this part, the role of the pharmacist is very crucial on the proper counseling to the patient on the proper use of the discus inhaler that will soon result in the medication's efficacy and effectiveness. For the next slide, we're going to discuss the illustrative parts and the definition of each parts of the discus inhaler. Actually, the discus inhaler contains 4 parts, which are the dose counter. As you can see here in the slide, the dose counter is a small like circle shape just below the thumb grip. Then we have the thumb grip, the dose release lever, and the mouthpiece. So the dose counter shows and indicates the number of doses remaining in the inhaler. For the thumb grip, as you can see here in this picture, the thumb grip serves as the opener of the inhaler by sliding the thumb grip. So you're going to slide the thumb grip until the patient hears a click sound that indicates that the thumb grip is successfully dragged down. Then for the next one, we have the dose release lever. This is the dose release lever, which slides the lever to release the dose from left to right to load the dose until the patient hears a clicking sound. And then we have the mouthpiece. You can see the mouthpiece here in this slide. It is the one that is placed in the mouth where the patient breathes deeply and rapidly. For the applications of the device, the discus inhaler is a product that is used to control and avoid the symptoms of shortness in breathing, wheezing caused by asthma, persistent disease in the lungs such as COPD or chronic obstructive pulmonary disease that would include the chronic bronchitis and the emphysema. Examples of the discus inhaler. As you can see here in this slide, we have the example of Advair discus, which contains the generic name of fluticasone propionate plus salmeterol. So the fluticasone propionate belongs to the class of drugs called corticosteroids that reduce the swelling and irritation of the airways. Then we have the salmeterol, which belongs to the long-acting beta-agonist class of drugs that is responsible in relaxing the muscles surrounding the airways, leading to its dilation. So in medical term, dilation means it is making the muscles surrounding the airways wider for the patient to breathe easily. Then the brand name would be Advair discus, which contains 100 micrograms and 50 micrograms. We have 60 blisters in one foil strip. For the next example, we have Flovent. So, Flovent with the generic name of fluticasone propionate is not used to cure asthma, but it is used to treat the symptoms of asthma by reducing the inflammation of the lungs, airways, making it easier for the patient to breathe easily. So, the Flovent Discus Inhaler contains 100 micrograms and 60 blisters in one foil strip. Some asthma medication may have been recommended to be used with a dry powder inhaler or DPI. So in today's presentation, I'm going to show you the simple steps or the proper usage of the Discus Inhaler. Before using your Discus Inhaler, you want to make sure to check for the dose counter. So this is the dose counter. Check for the dose counter to see the number of doses remaining. If it turns red, it means that your powder medication is nearly empty. And if it turns 0, it means that your powder medication is already empty. And this is the proper steps on how to use the Discus Inhaler. For the first step, you hold the Discus Inhaler in the left hand to insert a dose. Then place the right thumb to the thumb grip. So this is the thumb grip. Then push the thumb away from you and as far as it will get. This action unlocks the discus, revealing the lever beneath. Ayan. Then maintain a level flat position. So as you can see here, the patient maintains a level flat position for the discus. Then when the lever clicks, slide it away from you. This action loads the medicine dose. Then upon loading the medicine dose, you can see that your dose counter will be reduced by 1. And for the step 3, turn your head away on the discus and exhale as much air as you can comfortably. Example, if I were the patient, and this is my discus because it is shaped like a disc, I have to turn my head away from the discus and exhale as much air as I can comfortably. So, it is like I am emptying my lungs with air. Then for step 4, place the discus mouthpiece in the mouth and breathe in deeply and steadily, but not too quickly until your lungs are completely filled. As you can see here in the picture, the patient placed the discus mouthpiece in the mouth, and she makes sure that she closes the her mouth closes the surrounding of the mouthpiece, and she breathes in deeply and steadily but not too quickly until her lungs are completely filled. So this is the level of oxygen on her lungs, and it's slowly filled with the Discus Inhaler. Then for 10 seconds, you have to hold your breath. And then for the next step, the patient exhales slowly after removing the discus up from the mouth. So, as you can see, the patient exhales slowly away from the discus. Then wipe the mouthpiece clean after using it. Then after using your Discus Inhaler, you have to make sure to place the thumb in the thumb grip and glide it back as far as it will go to close the discus. This action resets the inhaler and ready it for the next dose. Then you have to repeat the previous methods when you are you are prescribed with more than one dosage. Then you have to rinse your mouth and gargle. Do not ingest if the discus includes a steroid, then spit. So for the next slide, we have counseling. So on top of the discus is an indicator. So I have showed you earlier, this is the indicator. The numbers on the indicator indicated how many doses are left. So when there are 5 doses left in the discus, the indicator will turn red, meaning it will soon be empty. when the number turns 0, it means that the discus is already empty. Take note that it is always a good idea to get a new discus before the number reaches 0. So you have to remember that when not in use, it is best to keep the discus closed and dry. The discus does not require routine cleaning. A cloth should be used to clean the mouthpiece if it is unclean. Next will be the storage. In the storage, the discus should be stored at a room temperature between 20 degrees Celsius to 25 degrees Celsius. The discus should also be stored in a dry place away from direct sunlight and heat. And the discus should be kept in its unopened foil pouch until ready to use. In using the discus inhaler, it is important to take note that there are also common side effects that is unavoidable. So there are common side effects of discus for asthma, which includes upper respiratory tract infection, throat irritation, hoarseness and both voice changes, thrush in your mouth or throat, bronchitis, cough, headache, nausea, vomiting, and in children with asthma, infections in the air, nose, and throat are common. Next will be for the serious side effects. We have pneumonia, which is common or which have a higher chance for people with COPD. Weakened immune system and increased chance of getting infections or immunosuppressions. We have reduced adrenal function, sudden breathing problems immediately after inhaling your medicine, serious allergic reactions, effects on the heart, which includes increased blood pressure, a fast or irregular heartbeat, chest pain, effects on the nervous system, which includes tremor or nervousness, bone thinning or weakness, or osteoporosis, slowed growth in children. Then we have eye problems. Upon using your discus inhaler, or when your discus inhaler is already empty and you need to dispose it, the easiest way to dispose of the inhaler is by giving it to the local pharmacy, since it is considered as a hazardous waste. For the next slide will be the last example of dry powder inhaler or DPI. So, as you can see here in this slide, is an example of the Rotahaler inhaler, which is an inhalation device that is made in plastic where the patient breathes in order to be activated. So a powdered medication enclosed in a capsule known as the Rotacaps is being placed in the Rotahaler. So this is an example of the powdered medication which is enclosed in a capsule and is being placed in the Rotahaler. This powdered capsule medication is called Rotacaps. In order for the patient to inhale the drug, the Rotahaler releases the powdered medicine inside the Rotacap, which I will further explain on the illustrative parts and functions of the Rotahaler inhaler. Then, it provides an increased effectiveness in the medication when it is inhaled correctly that results in the engagement of the medication even in the small airways of the lungs. Like as I have said earlier on the discus inhaler, the pharmacist or the role of the pharmacist is very crucial on the proper counseling of the patient for him or her to correctly use the medication or the device effectively. For the next slide, we're going to discuss the illustrative parts and definitive function of each parts of the Rotahaler inhaler. So, it is similar with the discus inhaler. The Rotahaler inhaler also consists of 4 parts, which are the Rotacap hole, the fin, the base, and the mouthpiece. You can see the parts here in the slide. For the Rotacap hole, it has a square hole where the Rotacap is inserted, where its transparent end is face downward, while the colored part is on the top. So here in the example picture, you can see that the rotacap hole is where the capsule is being inserted. And it is important to take note that the colored part must be on the upper part and the transparent end must be on the lower part. Next, we have the fin. It is used to open the capsule placed in the rotacap hole. So this is the fin. When the base is rotated, the fin will also move, leading to the capsule's breakage. Here is an example picture of a fin being, a rotacap being opened by a fin and a base. So as you can see that when the base is rotated, you can see that the transparent end of the capsule is separated on its colored part, which leads to the capsule's breakage. Then we have the base. As I have said earlier, it is the one that is rotated to break the capsule. Lastly, we have the mouthpiece, which is the one inserted into the patient's mouth, where the patient takes a deep breath through their mouth to inhale the medicine, which is similar to the discus inhaler. Next will be for the applications of the device. So the Rotahaler inhaler is where the capsule known as the Rotacaps, as I have discussed earlier, which contains the powdered medication. So the capsule contains the salbutamol sulfate that belongs to the beta-2 adrenoceptor agonist. So it has a very fine powder that provides a certain amount of drugs patients should breathe into their lungs. So take note that the powder of inhalation should have a very fine powder. So it is beneficial when you experience difficulties breathing, chest tightening, wheezing, COPD, and exercise-induced asthma. The rotacaps of the Rotahaler inhaler dilates the breathing tube into the lungs, or it widens the breathing tube into the lungs. That can be very helpful for the patient to breathe easily. And it gives rapid relief in different chest symptoms. Next will be the examples of the Rotahaler inhaler. So for the first example, we have the Rotahaler inhaler, which contains the Ventolin Rotacaps, which contains the salbutamol sulfate powdered medicine in a capsule, which belongs to the beta-2 adrenoreceptor agonist that gives a rapid relief if the patient is having difficulty in breathing, wheezing, and feeling of tightening in the chest. So the Ventolin Rotacaps contains 200 micrograms and 128 capsules. So for the second example, we have Astalin Rotacaps. It contains salbutamol as its generic name that is used as a bronchodilator that helps the patient to breathe easier by dilating the bronchi, or as I have said earlier, it is used to dilate or widen the bronchi, relaxes the muscle of the lungs, and treats many respiratory diseases such as chronic bronchitis, COPD, and asthma. The Rotahaler inhaler was created to make inhaled treatment more convenient and effective for asthmatic patients. And in this next slide, we're going to discuss on the proper usage or the stepwise manner on how to use the Rotahaler inhaler. So for the first step, so you have to hold vertically and adjust the two halves of the Rotahaler inhaler so that the fin is not directly beneath the rotacap hole. So you have to make sure that the fin is not directly beneath the rotacap hole because it is where you're going to insert your capsule or the rotacap later on. Then for the step 2, remove the rotacap from the bottle and place it in the rotacap hole, transparent and pointing down. As I have said earlier, when placing the rotacap on the rotacap hole, you need to take note that the colored part of the capsule or the rotacap should be on the upper part of the rotacap hole, and the transparent part should be on the lower part of the rotacap hole. For this step 3, hold the mouthpiece firmly in one hand while rotating the base. So as you can see, the patient here holds the mouthpiece on one hand and he holds the base on the other hand while rotating it. And for the step 4, this is the most important step because it is where the patient is going to use the Rotahaler inhaler. So place the Rotahaler inhaler's mouthpiece between your teeth. Inhale deeply through the mouth. Close your lips securely around it. So the patient place the mouthpiece of the Rotahaler inhaler between his teeth, and when you're going to place the Rotahaler inhaler between your teeth, you have to make sure that your lips will securely close around the mouthpiece, and it is important to take note that there should be no space between the mouthpiece and your lips. And bend your head slightly backward. So you can see here in the picture, the patient bends his head slightly backward upon taking the Rotahaler inhaler. Hold breathing for 10 seconds or as much as you feel comfortable, then exhale normally. Upon taking the Rotahaler inhaler, it is normal to hear a whistling sound which shows or indicates that you are using the Rotahaler inhaler in the correct manner. Then for the last step, if any powder remains, you should go back to step 4 and repeat it. So it is important to take note that when you are using the Rotahaler inhaler, there should be no powder or medication powder left. And remove the empty capsule from the Rotahaler inhaler and discard it. For the next slide will be the counseling. For the maintenance, the Rotahaler inhaler should be cleaned once every 2 weeks or sooner if needed. Regular cleaning will prevent the powder from accumulating inside the Rotahaler. The empty capsule shell should be removed before washing the Rotahaler. Warm water should be used for cleaning and the device should be dry before reassembly. So I think of the Rotahaler inhaler is similar to the nebulizer, where it should be dried before reassembly. It is recommended that the Rotahaler not be used if it is wet, and that no fabric or instrument be pushed into the mouthpiece, as this may cause harm to the patient. Keep the Rotacup container tightly covered to limit moisture exposure, and only remove a Rotacup from its bottle and insert it into the Rotahaler before use. Then we have the storage. The Rotahaler inhaler should be stored below 25 degrees Celsius in a cool and dry place. The Rotahaler can be used daily for up to 12 months. And as similar to the discus inhaler, the Rotahaler inhaler also has common side effects which are unavoidable. So the common side effects for the Rotahaler inhaler includes throat irritation, common cold, stuffy and runny nose, UTI, backache, pain, muscle tremors, nausea, vomiting, and others. So for the disposal of the Rotahaler inhaler, it is important that the inhaler is disposed by giving it to the local pharmacy because it is considered as a hazardous waste, which is similar to the discus inhaler.
This is the part 4 and also the last section of our presentation. I'm Maria Juliet Pidolarmente and I'll be presenting the new device research. Our topic is all about biological product gel for surgical hemostasis, and I hope you're still with me in this presentation. What is hemostasis? Hemostasis is a process that functions to limit blood loss to an injured vessel. Hemostatic agent promotes hemostasis or stop bleeding. Hemostatic agents used in medicines have a variety of mechanism of action: the systemic drugs and the local acting hemostatic agent. The systemic drug inhibits fibrinolysis or promote coagulation, while local acting hemostatic agents cause vasoconstriction or promote platelet aggregation. The biological product gel for surgical hemostasis is made up of two lyophilized powders. One lyophilized powder contains fibrinogen, 13 coagulation factor, and microfibrillar collagen. The other lyophilized powder contains thrombin and microfibrillar collagen. In addition, lyophilized powders are dissolved in solvents. As you can see in this slide, this is the illustrative parts of the hemostatic gel. It is just like an injection and common syringe that we all know. Hemostatic gel has three parts: the syringe, the plunger, and the applicator tip. First is the syringe. The syringe is a prefill that contains the hemostatic gel. Next is the plunger. It is used to expel the hemostatic gel through the applicator tip. And lastly, the applicator tip, which means that enables precise hemostat delivery into a small and difficult to reach surgical sites. Okay, so we proceed to the proper usage of hemostatic gel, and it demonstrates the stepwise procedure on how to administer the gel properly. First, identify the source of bleeding. Second, apply a sufficient amount of gel that covers the entire bleeding area. Third is to apply sterile saline moistened gauze over the gel and leave it for 1 to 2 minutes. Fourth, gently irrigate the excess hemostatic gel away. And lastly, in case of continuous bleeding, repeat the application of hemostatic gel. For addition of information, hemostatic gel is used in surgical procedure for hemostasis when it's not controllable with vessel ligation, pressure application, or electrocautery. We will talk about the function of hemostatic gel or how it will work on our skin. Hemostatic gel are used in surgical procedure to achieve hemostasis. They are categorized as hemostats, sealants, and adhesives. Fibrinogen is hydrolyzed into a fibrin monomer. It is under the action of thrombin, which is subsequently cross-linked to produce solidizable fibrin solids that adheres to the bleeding wound surface and stops the bleeding. Lastly, microfibrous collagen is a local hemostatic substance manufactured of bovine dermis that is absorbable. It will collect platelets to form a clot that stops the bleeding immediately. Maintaining surgery is critical to preserve a patient's physiological processes that allows the surgeon to visualize the operative area, ensure successful wound management, and patient outcomes. So, using biological product gel for surgical hemostasis has the following benefits: quickly control bleeding, reduce surgical blood loss, reduce operating time, and last is the reduced hospital length of stay. We will discuss counseling in using hemostatic gel. Here's some do's and don'ts when using hemostatic gel. Let's talk about the do's. First is read the direction. Everyone knows that we should read the direction first for us to make sure to understand the direction for preparing and proper usage of the hemostatic gel. Next is inspect the package before using. We need to inspect the package to make sure that the device does not have damage. When the package is damaged, sterility is not assured and therefore the contents of the gel must not be used because it may cause harm. On the other hand, the don'ts. First is the use of the product immediately. Do not use immediately because the hemostatic gel must be used approximately 8 hours after preparing the gel. Next is using the excess of hemostatic gel. Do not ever use the excess of the gel because only a minimum amount of hemostatic gel is needed to stop the bleeding and the hemostasis is already achieved. The excess gel should be removed carefully. Hemostatic gel must be stored in a dry place at a controlled temperature between 36 to 77 degrees Fahrenheit or 2 to 35 degrees Celsius. When disposing the hemostatic gel, the unused open product should be discarded since the gel is a single-use product. In addition, there are possible side effects of using hemostatic gel. including hives, difficulty in breathing, swelling of your face, lips, tongue, or throat, and abscess formation. If you have any symptoms, get medical help right away. To summarize all of the key points that we discussed in this presentation, the development of inhalers such as metered dose and dry powder inhalers is important due to the fact that these inhalers help people with respiratory problems breathe properly. The difference between the two types of inhaler is that the metered dose inhaler is more of spray similar to an aerosol, which provides a short to long lasting action, while dry powder inhalers contain powder without a propellant. Dry powder inhalers usually a longer lasting effect when compared to the effects of the metered dose inhaler. Discus inhaler is a medication intended to treat and prevent symptoms of shortness of breath and wheezing caused by asthma or COPD. A rotahaler is a breathing-activated plastic inhalation device. As you breathe in, the rotahaler releases medicine from the rotacav. In conclusion, the both of said types of inhalers are situational and have advantages and disadvantages. The type of inhaler to be used depends on what the disease is and how it can be treated. The understanding of how new devices work is beneficial for all, as the new knowledge gained might help save a life or two. Maintaining hemostasis during operation is important due to the fact that the surgeon needs to have a proper view of the organs being operated during a surgery. The development of the biological product gel for hemostasis is important as it allows the surgeon to ensure a successful operation for the life of the patient. So, this ends our presentation. I hope you learned something from our group. Thank you for watching and listening.